pitch as you feel appropriate to the audience here.
Thank you very much. It's a challenge to open up speaking about
Not for you.
longevity economy. So I will try to make it sort of elevator pitch divided in two parts. Part number one, the way I pay my bills. Working as a consultant for pension funds, for insurance companies, and asset managers. They have a big problem. People are living longer and longer and longer. One of the pension funds, they have already 2,900 people above 90 years old. More than 100 years old. So, a fact, longevity for those guys is a risk. And there's no coming back. It's going to happen all over the world. This is part of the longevity economy. The second part is people are with lower and lower fertility rate. More educated women are, less children they will have. Because, you know, I don't have to explain that. So in the future, and I mean in this century, society is no longer be described by the traditional demographic pyramid. The pyramid is going to be like that. And this is the way it is in some countries, like Singapore, Germany, Portugal, etc. So this is the way I technically explain what is the longevity economy and the way I pay my bills. The second one, my passion. Longevity economy means for me to reinvent retirement. Retirement, it's a very boring idea, a very obsolete concept, which was created in Germany in 1989. Since that, the life expectancy increased 40 years. All the institutions are changing. Marriage, democracy, but retirement during the after the Second World War became, you know, the dream for everyone. And so when people are in their 50s, they just think about retirement. So they have my empathy because the work, as it is defined in our society, it's a pain. It's hard. It's toxic. Most of the employers don't deserve us. And I think we should think differently. I belong to a generation, I'm a baby boomer, I am a man of 70 years old, and I think the first year of retirement can be okay, but after that, it's a boring life. You can imagine how boring the retirement life is. I cannot emphasize as much because it's emptiness, it's social disengagement. It's, I opened one of the keynote speaking that I made for a pension fund in Brazil for the annual congress with a slide telling the people, retirement is not good for your health. It's not good for your cognitive health, for your mental health, and especially for men. And then I'm committed with the challenge of helping people to co-create a new narrative of retirement. That's it.
Maybe just a minute talking about yourself and what you do now. I missed out on that.
Okay. One right. Thank you very much. Well, nobody's perfect. I'm Brazilian. And it allows me a lot of, good things. And I do not take myself serious all the time. It's too much. And perhaps it's part of the Brazilian Tsao. I live in Germany. I decided to immigrate to Europe to pursue a new challenge instead of being a traditional retiree in Brazil. So I live in Germany, and nowadays I spend at least 1/3 of my time learning German, which is a magnificent challenge. And of course, as a consultant, besides being a consultant, I decided to join the Catalyst now, and it's my proposition, the 50 Plus chapter, which is a conspiration to help baby boomers and X generations to co-create a new narrative for work linked, related with purpose.
Thank you, Ricardo. And don't be shy to just wave your book at everyone here. Ricardo's an author. He didn't have a free copy for me, which is a shame, but it's available on Amazon.
Yes, this is a book that I wrote with somebody else who has the skin in the game of traveling the time, Sonia Gill, my partner. So Sonia says that instead of aging, I have the privilege of traveling the time. So it's a call to action. It's not a book of research, although there are consistent data to prove that, among other things, retirement is not good for your health.
Thank you, Ricardo. We'll move on to Marianne. Wonderful to have you here from Singapore, which is close to my heart, as you know. So over to you.
Right. Thank you for having me. So my name is Maran Sao. I was trained as a public health pediatrician, and I was practicing in New York for many years. And then one day in 1992, I was called by my grandmother to go to Singapore to start a foundation for the well-being of older people. So, of course, that was quite a journey, but by now, I guess I've been doing for 30 plus years. And it's something that I'm really pleased to be asked to talk about, something I've been thinking and working on for the last 30 plus years. The topic of how people live long and live well is very close to my heart. I think that back to retirement is that not everyone has a privilege of retiring, actually. In my parts of the world, in Asia, in the less developed countries, some people just have to keep working. And for them, it's actually they should have the option not having to work so hard. But others will have the option to not to retire if that's not what they want. So many ways, I think the way we grow old is going to be very, very different from different people. And I think the key thing is be able to have choice. So why did I end up in Singapore with my grandmother? Because she said she was 86 years old, and she thought about what her life purpose was. And she said her whole life she'd been someone's daughter, someone's wife, someone's mother. And for once, this was a year after my grandfather passed away, she's going to live as her own self and do something meaningful for her. And her observation was that at 86-year-old, the world is unkind. The modern society was unkind to old age. She was quite concerned older people will not be able to have choice in where they want to live, be sent to a nursing home against their will, or the children relationships not good, so the families are breaking apart, or they're worried about them having the ability to control their life, make decisions for themselves, be taken away from them. So she just thought that she need to do something to kind of enhance the well-being of older people, so to continue to live as we live as younger people, to continue to be able to live with a family in a home you want, be surrounded by people that care about you, be able to grow and develop as a human being, and be ability to be the master of your own destiny, be able to make own decisions. So those days, it wasn't really resonating with me so much because I was young then. But I think in the 30 plus years, I really appreciate all the things she said was really quite true. So those are things I've been working on for quite a number of years about aging in place, promoting ability for older people to live at home, building services required so that even on their deathbed, if they want to live at home, they can still do that. Right? And of course, keeping people healthy and is very important. And building relationship with the family and community. So that's continue with the solidarity between generations, whether it's within family or within the community or societal level, so that generation can continue to support and care for each other. And also the ability for older people to have their own agency, be empowered to make decisions for their own. It seems so straightforward because we live those lives every day, but the reality I had when I was working in Asia and Singapore wasn't like that. But I'm happy to say it's gone better. In those days when we started, growing old was a dirty word, like the burden of aging, the silver tsunami, I'm so sick of that. I mean, luckily those languages gone better, but they're still there. But actually, in fact, if you think about it, getting to live 20, 30 extra years is not a bad thing. I don't think anyone volunteered die sooner because we don't want to be older, right? The key question is how we're going to take advantage of those 20, 30 years so it's good for ourselves, good for our family, community, and good for society. I'm not saying that there are no challenges, for sure. But on the other hand, the flip side is a lot of opportunities for us to do well, and do well for ourselves and for everybody else. And I think the future is how we plan it. I think for our current generation of older people who have not have had the benefit of good pension funds or health care and long-term care, we work to build those. But for those of us here, it's a plenty of opportunity to create a new future. The future is how we plan it. We invest in our good health today. We'll be healthy when we grow older. We make sure that we're financially secure. We have income security. So whether it's an individual or a family or society, the future is how we make it. And that took us about 20 years convincing our government that aging is not doom and gloom. That if you invest in today, the future generation, the future of aging will look different. So I think this is really the pitch, is that think about aging differently. It's not aging, it's a privilege of living longer lives. We'll have to deal with the challenge of the poor health or caregiving, whatever it is that many opportunities to create a new future. And for the business people, from a business family. I chair my family office. I look for investment opportunities. There are plenty of opportunity for new enterprises that cater to the need of older people. The other day, I was traveling to Mongolia with some younger friends, and the program, the travel agent created, was way too much for me. I want travel services to be a little bit more for my age, not hiking 25 miles a day. No, I don't want that. So there are different products for different groups. So that said, I want to say that the Asian experience is very different. Asia already has more older people than the rest of the world, and Asia is just beginning to age. And many countries in Asia are not developed countries, so they will have very short runway to develop the social infrastructure and healthcare and all that. The gerontologists talk about how Europe, US, the society grew rich before they grew old, and a lot of development countries, particularly in Asia, they're going to grow old before they grow rich. So there are definitely challenges there, but also there are a lot of opportunities. But I do want to make a shout out that aging is very different. Men, women, very different. Whether a policymaker, a program provider, you have to think differently. Urban, rural, very different. North, south, very different experience of aging. But I think that the good thing is that aging is not just aging. That's something we're born. We'll go on.
Conscious of time,
At this moment, I'm wrapping up and saying, that's all I want to say, but thinking about longevity as privilege.
Great. Last but not the least, Jackie, the floor is yours.
Thank you. It's actually, to start with, a privilege to be on this panel. And my name is Jackie Maalouf. I'm from Lebanon. You hear about it all the time on the news, bad news mostly, but hopefully you will hear some good news soon. I happen to be the founder and the president of a diabetes organization in Lebanon, and currently I am the elected vice president for the International Diabetes Federation. So my perspective to talk about longevity is going to be mostly from the health perspective, but I want to add to that I also wear a different hat, which is being on the governing council of Catalyst Now, working on social innovation and being the co-chair for the MENA region in Catalyst Now as well. So if I want to talk about longevity, I would start by the definition of health and how it evolved through the years. Because I'm sure you all understand that we just don't want to live, but we want to live good quality of years, not just any adding years just for the sake of it. So health started back in the time as the absence of diseases. Now we do know that that is basically impossible. So in 1948, the World Health Organization redefined the definition of health, thankfully to that, and it included good health and well-being and all these socioeconomic factors related to that as physical health added to mental health, added to the overall well-being. Now, this is health. So we are, thank God for the redefinition. And if we want to talk about longevity, my pitch to you is to look at it not as a burden on the GDP of a country. Let's look at it as an opportunity. How many older people with good health, a lot of experience, a lot to give back to society don't have jobs? Why? Because of our systems, certain age, you stop working. They're not allowed to hire you because you are of a certain age. So this is very important. We are not, and I say we because I'm definitely over 50, and I'm very proud to say that I'm 60 and that I'm a grandma of 4 boys, going to be 5 very soon in the coming days. And this is something to be proud of, to feel blessed for. It's not a shame. It's something really you should be proud of saying your age. I don't know why we have this fame that women like to hide their age. My age tells about my experience, my lived experience. It tells about my richness. It also tells about my values. you know. So let's not be ashamed of age, and let's enjoy every era, every episode in our life to the fullest, because this is how we get to have good mental health. This is how we control our physical health even without knowing it. And this is how we get to the stage of well-being that we so badly seek in whatever we do. Do you want to have the state of well-being? Who doesn't? Anyone doesn't want well-being? We all want well-being. So let's focus on that. Let's mind our physical health. Let's mind our mental health. And there are many ways. If I want to speak like a strategy, I would enumerate all the components and the determinants of longevity, but that would be boring. You can go on internet, put longevity, one click, and you would have tons of information. We are here to share with you our experiences. We are here to pitch for the idea of longevity as an enjoyable thing, for the idea of the one extra year I'm living should bring more joy to my life, should not be a burden on society, should not be a burden on my family, definitely should not be a burden on myself. So if we believe we are good to live longer, and we should believe that, trust me, we will make our families believe so. We will make our societies believe so. It's a vicious circle, but in a good way. It's a good circle to start. And then the governments will believe that the people who live longer are an asset to the society, not to be neglected. We are a power. We are a driving power. I mean, if I think to myself, I would like to think about myself as the new definition of a grandma. How wonderful is that? So from that perspective, yes, coming from a health background, I'm happy to say that at the International Diabetes Federation, we are very mindful of the fact how important well-being is to us, to the point that we have put a title for the next 2 years under well-being. So we mind physical health and we mind mental health as well, in order to live longer, but a good quality of life. Am I within the time?
A little more, but it's okay.
Thank you.
No, but listen, thank you so much for each of you, just in terms of unpacking all the things you're working on. And as we know, longevity is not straightforward. Everyone has different priorities. I made some real quick notes here. Marianne talked about choice. People have choices. Retirement is boring, Ricardo. Getting old can become a burden. And I think that was you again, Marianne. And Jackie spoke at length about health and how, and I think it doesn't escape us that all of this is so interconnected. And, you know, we can be very silo in the way we think about retirement and about longevity, but I think we need to keep in mind that there is a lot of interconnectedness here. So let's pick up on what you said, Ricardo, in terms of retirement is boring. And so my question to you would be, I know from our previous conversations, you've talked about reinventing retirement is central to the way we think about longevity, and that's the title of your book as well. So do you want to speak a little bit more to that and why that's important?
Well, I think retirement is the cornerstone of a mindset which is not aligned with the new longevity. What does it mean, new longevity? It means that we are heading towards to have, as a business as usual, a centenary life. So I'm sure that
Your mic.
Oh, yeah. Thank you very much. I'm sure that the Z generation, they are going to find absolutely normal to live 90 years old, 100 years old. Well, we are starting to realize that. The pension funds, you know, they are there. They are looking forward to having, you know, the death certificate. But instead of that, they are having, you know, the problem, they are having the medical bills for the people who are living with the traditional retirement mindset. What is happening is that somehow we are still intoxicated by the vision that life ends after 60 years old. And so what happened is people who are in their 40s, and especially people who are in their 50s, they start dreaming. They are looking forward to the retirement, but there is no role model for life after 60s. So the challenge for baby boomers, for X generations, and for other generations is how we can figure out another kind of life that means to be socially engaged, to be working with purpose, and time to celebrate life. Because it's important to have time for myself, for doing whatever. But a commitment with myself is very important. And this is why we are using the 50 Plus chapter as a sort of a self-help groups. In meetups, we have a roadshow, and everywhere we go, we understand that 50 Plus people are living a sort of second teenage of their lives. Yeah, when I speak for millennials and for Z generation, I say, okay, you can give this book to your dad and to your Mother's Day and their Dad's Day, and please have empathy with them because they have now a new teenage, like you. They have an definition. They were promised to have the golden age of traveling, all those teasing from retiring people. It's a boring, it's the emptiness. Emptiness, it's a very serious thing. There is a strong correlation with retirement and dementia, with cognitive decline. So we have to take it serious. We are not going to sort it out with a new pill. Because everyone would like, that's the dream of humanity. It doesn't matter for what, but if there is a pill, it's okay, it's better. But it's not like that. It takes a hell of work to reinvent a new kind of life, a new proposal for life for people after the 60s. And we are going to co-create that together. So when you are starting to metamorphosize, if I can say that, the dream of retirement into something else, where it's how can I be reconnected with society? How can I learn, lifelong learning? How at the same time can I have time to myself? Because during the working time, so life was defined in the beginning, 21st years, education. 30 to 40 years, the inverted U for working, rat racing. And then the dream of retirement. And then you have 30, 40 years ahead. So at the same time that we have to reinvent retirement, I'm suggesting that we have to reinvent work. I mean, we have productivity with that technological tools that allow us to have 4 days per week, 6 hours. That's enough. The bosses, the CEOs who are not admit that, they are ignorant. They are stupid. So at the same time that we are redefining the retirement, we have to redefine the work. And work must be with purpose.
Ricardo, I'm not 60 yet, but I'm already behaving like a teenager the last 5 years. My wife is at the back there; she will confirm that. But I think you do hit upon a point, which is you have choices. You decide how to lead your life, and that takes me back to what Mary Ann said earlier about people have choices, and I know that's something we've talked about in the past. So, do you want to talk a little bit about that in terms of opportunities for people in retirement and how they make the choices?
I think the retirement, I think it really depends on the situation. And in a lot of the communities I work with in Asia, they don't have an option to retire because they just have to keep working until, they can. Most just need to keep working to put food on the table. But on the other hand, I think there are people, people have the choice of reinventing their life, and I think that's really great. I think back to the work. I think the work is important, because the last 30 years I worked on different areas about longevity. Firstly is actually, what does it mean to grow old? What is that? Is it a number? We all know that we grow old later biologically and age slower. So we all know that, the 70 today, like me, is like it's like the 50 last before or something. But so I think clearly it's a different situation. But the thing is that, the world hasn't caught up with the fact that aging numbers are really not making the same sense that it was before. But I think the thing about work is important because a lot of people do want to work. Now, some people may want to just say, I'm finished my career, I'll go do something else, but people do want to work. And many people want to work because they need to work, because they need to earn money, because now living a lot longer years, a pension may not be enough for those who are lucky enough to have pension. Second, work gives us purpose. Work keep us engaged. Work give us a social network that sometimes people become isolated from if they don't have the work environment. So it's important. But the fact is that when it comes to employment, I think Ricardo already referred to it, is that employers kept thinking there are a lot of young people to hire, and then kind of forever, by the time 50, you become obsolete. You can't learn anyway. There are a lot of ageism, prejudice around the mature worker. I don't want to say old, 45, 50 in Singapore, that's considered mature, and already the risk of being laid off and never be able to get a job again is very high. And so this one, the employers think that forever they can have young people to do a job, and that's just not true. And it's also not fair to themselves or the older worker, because older people obviously can't have much to contribute. But I think that back to one point about what means to be old is a mindset, and a lot to do about lifelong learning. The curiosity to continue to learn, continue to be relevant, continue to know what's going on in the world. And I think that's something that we all should continue to do, is continue to learn and be curious about the world. And I think that also keep us engaged. Social isolation is one of the biggest issues when people withdraw from society, right? Because either they stop working or for whatever reason. And that is, we all know that they have more mental health issues, more physical issues, they die sooner. And the quality of life is really terrible. So being able to not be socially isolated is very critical. So I think that, again, working gives people the opportunity. And work could be very loose. You can have full-time employment, part-time employment. I could do gig work. I can whatever. But the notion of work is still very relevant to everybody, even as they grow older.
Thank you, Marianne. And I think you've touched upon, you've mentioned a few things there that resonated with me, and also with what Ricardo was talking about earlier. He talked about being relevant, being socially engaged. You talked about mental health, and Ricardo, you talked about cognitive health. So who better to bring in here than Jackie, who brings the health perspective to longevity. I'd love to sort of touch upon those things in terms of cognitive health. And I know you've also talked about physical health in the past. So Jackie, over to you.
I will start by acknowledging that one of the main challenges in relation to longevity are the NCDs, which are non-communicable diseases. We have to know that, because everything that's being discussed is so beautiful. It's amazing. I resonate with that. But thank goodness I'm in good health. What if I don't have that? Then we need to tackle things from the base. We need to start with physical health and other, it goes hand in hand. I'm not saying physical health and minding the diseases, living with a good management of a disease if we have it, are the most important. Everything is interconnected. We have to have a solid base, starting with emotional well-being, good mental health, as well as good physical health. But again, good physical health does not mean the absence of disease. I am the mother of a daughter living with type 1 diabetes. She's married, she has 2 boys, she's professional, she's brilliant at what she does. And she is minding her physical health, her mental health, and thriving for the well-being that we all want. So we need to think that there is a key point, a key component, very simple, that we overlook, which is lifestyle. If you listen to all the health conferences, and I attend a lot, and I speak at a lot of them, mainly we are speaking about lifestyle. We are not talking medication. I personally refuse to speak about medication. I like to speak about lifestyle, changing your lifestyle, which does not mean being another person. No, it's being a better version of yourself, eating better, sleeping better, doing a little bit more exercise. If you don't do at all, start by walking. So this is lifestyle. This is how you care for yourself, because you need to love yourself in order to be able to deliver love to others. And this is really a main component. And sometimes I have this talk on a one-to-one with our community, people who are living with diabetes. And I'm not saying it's easy, but if they take control, take charge of the situation, things will become easier. One young lady told me once, I take ownership of diabetes. I know and I acknowledge it is part of my life. I won't let it win over my health. I want to be the winner. This is the attitude we are seeking. Not always easy. We're not taking the easy path here. We're saying there is an alternative. There is a choice, as my colleagues are discussing. But that choice have to highlight in front of our eyes the importance of being in a good physical state as well as a good emotional state in order to really feel the well-being and live more years, but in the quality of years that we decide to have. Let me acknowledge here, I don't want to be understood as we have control of everything in an absolute way, because we don't. Let's face it. Especially myself coming from Lebanon, which is a war zone most of the time, where people die not because they don't have good health, not because they don't have emotional or mental good health, but because things are happening out of their hands. So I'm saying, given the situation, the societal determinants of a good society away from wars, we can have to some extent, the control of our physical health as well as our mental health. And that will help us get to the well-being state. So remember, NCDs or non-communicable diseases are really a tsunami of nowadays, and I invite all of you to really educate yourself, because this is our weapon against any disease. Know about it. If you want to fight an enemy, God forbid that you have enemies, but if you want to fight an enemy, you will never win if you don't have information about that enemy. So let's get informed, let's have health literacy. And it's nothing impossible. No matter what your background is, I invite you to have some, at least, health literacy, because only through knowledge we can really take ownership and some extent of the control over our lives.
Wonderful. That's a great segue, just in terms of, if we, certainly from my conversations with each of you, I know you take a really positive view of longevity and the opportunities it offers. So if you were to focus on all the things that are accessible and available to people as they get older, and they don't necessarily think of themselves as being old, and life is an adventure, they're constantly exploring those opportunities. Maybe 30 seconds to a minute each. I'll start with you, Marianne. How do you see that? I mean, you're at that age where you're constantly dealing with people in terms of the opportunity that life offers at that age.
Yeah, and I think I just quickly resonate with what our colleagues saying about health. What I mean about investing now for your future is what I mean, right? So if you don't, watch what you eat, exercise, do all the things that you want to do now may be boring, but then you want to be healthy and have physical ability and not have disability, you need to invest in that. And the same thing for work. And I just wanted to kind of deviate a little bit by saying opportunities, because I think a lot of people who are from business background is to take advantage of the opportunity of an older population. It's just like when women start leaving the home and working outside, opened a whole sphere of business, from fashion for working women to convenience for dry clean, whatever it might be. The same thing when the population is older, particularly for baby boomers, they've got disposable income. And we want to eat well, we want to look good, we want to travel, we want to do all those things. So a lot of business opportunities that people are really not taking advantage of. So just summary, I would say that generally speaking, the world, whether it's an employer or whatever, have not called to the fact that the living 20, 30 extra years of life is here to stay. Whether you like it or not, you will live that long, right? Because healthcare is good enough. And it's even true for the poorer countries. But the thing is that work hasn't caught up, the market hasn't caught up. We haven't caught up to the fact that the numbers are kind of playing tricks in our mind. Somehow when we're 65 or 70, we're old or something. I'm turning 70 in less than a month. So the point is I want to celebrate that. I have my challenges. I have one bum ski injured knee that feels like 85 years old. to have some limitations. I'm not saying there's no limitations, but you learn to adjust for that and look for other opportunities, whether it's business opportunities or policy opportunities or how I lead my life. Back to the fact that you have choice, but you do need to plan for it. Know how to plan for future financially, health, relationship, all those. You do it today, so we have the future, whether individual, family, policy.
Great. Ricardo, 30 seconds to 1 minute. Opportunities.
Well, I'm a little bit not very convinced that the planning is the key to navigate this blessing of longevity. I think it's more the ability to pivot. I mean,
Microphone.
Mike.
I mean that the ability to pivot, because things are not going to turn out as you were planning. That's exactly what happens. I'm sorry. I have awful discussions with my daughters about that. And always I tell her, welcome to the adult life. You know, you have to be able to pivot every time, every single time. But there are some facts that you cannot change. So a centenarian life is there for the humankind. It's a blessing for everyone. It's going to happen everywhere. Less than 2 children is going to be the global trend. And do not preach or try to bribe the women for having more children, because they are not going to do that. So the pyramid, it's going to be inverted. And we have to invent together this kind of a centenarian life.
Jackie.
Well, I would like to resume, as per my own perception, 2 things. When we speak longevity, we have modifiable and non-modifiable factors. The non-modifiable factors are not in our hands, how long we live. No matter what we do, somebody else will decide how long we are going to live. On the other hand, on the bright side, yes, we have modifiable factors which will help us live longer in a good quality of life. So remember, lifestyle changes. Be curious and enjoy life. This is something that nobody should or can take away from us. If we have the blessing to live longer, and I'm certainly looking forward to that, I want to be able to enjoy life, to enjoy family, to enjoy every little joy of life, and to keep learning. This is key point I didn't mention earlier, but I myself, I'm seeking a new diploma right now. And I tell my grandchildren, because they were asking me when I was back in Washington last week, what are you doing? And I said, I'm studying. And they were like, Grandma is studying. I said, yes, because I believe life is an ongoing learning process. Never stop being curious. Never stop the will of learning new things, because it gives us hope for the future. It makes us look forward to getting somewhere. And this should never be taken away from anybody. So I wish you live longer. I wish you will be blessed with many, many years of a good quality of life. And I certainly wish that for myself. Thank you.
May I compliment with something? Sonia, my co-author in this book, she said to me, when we finish the work, we have to create a sort of mantra to put in a nutshell, you know, what is our advice. And she created this mantra: lifelong learning, living with purpose, celebrate life.
Wonderful. Wonderful.
Can I just make one last
Sure, of
comment?
course.
I just don't make it sound like we all live a healthy, fabulous, long life. I mean, you know, you can plan as you want. I agree. It doesn't mean you won't turn out that way. We don't plan at all. Maybe even less likely to get to where you want. But I do work a lot with older people who are, you know, for whatever reason, they will have poor health. They will deteriorate. They will actually have disability. But I think that wherever state we're in, we still deserve to live a good life, even if our physical health fails us. That's when policy, community, and family all have to step up to support those elders who are not lucky enough to have perfectly good health. So I just want to put that plug in to say that, you know, it's not a perfectly beautiful place, but it could still be a good place if we all come together to support each other.
If I could just say now, I mentioned the hats I wear. I want to say that my last comment was wearing my hat as a mother of 4 and a grandmother of 4 who are going to be 5 very soon. And that is the best hat I've ever worn, just to mention.
Wonderful. I'm going to open the floor up for just squeezing a few questions. The gentleman at the back.
Hello, thank you, and appreciate all the new perspectives. I was wondering on the edgy part of longevity. So projects want regulatory sandboxes or kind of countries that can enable research. And so there is a lot of the longevity research is funded through the crypto community. There is projects that want to do sort of network state pop-up cities where they bring in scientists and innovation capital in a massive scale, and they're looking for countries to partner with. And so I'm just putting this into the room in a way, like where is this welcome or embrace from governance to like tap into the theme of longevity? And yeah, there is, yeah.
I want to thank you for your comment and mention that we at Catalyst Now are into discussion of a good project in relation to longevity. And Ricardo and I have had some discussions, and we will definitely, if we have the chance and the proper support, go in depth into that and try to create in several parts of the world longevity zones, like where we can help people live longer, or if they have certain determinants of longevity, help them explore what they have and make use of the resources. But thank you for your comment again.
I just like to comment on that. I think generally speaking, the idea of an age-friendly city, at least for cities, is a well-established concept. WHO established that some years ago, and many cities around there, like New York, parts of Shanghai, aspire to be one. But no city yet, and I'm not talking about rural area, has yet come up with a perfect solution. Japan had a small community that really connect all the dots. But I think that, like Singapore, for instance, would be would have like a lab, a living lab. And so it's always looking for a solution whereby the built environment, people know they can come together. So.
Last question.
Sorry, we'll have a question from you there, yeah.
Thank you so much, Manoj. Hi, I'm a physician, I'm a surgeon myself, and I've been working for about 20 years in healthcare. I wanted to understand 2 things. One is the quality of life from a health perspective. So we still don't have any understanding of geriatric care because it's so complex in so many areas. And geriatric care, from anything, from the caregiving or the insurance and the finances perspective of it, has failed in several different models across. So what are your thoughts on that? Second is, what are we doing to support quality of life apart from, say, long projects like biohacking and PRP therapies and stem cell research in that area. But what about early screening, something as basic as early screening? And diabetes is one thing that will benefit immensely from recurrent early screening, but still we don't have that as a norm for better part of the world. So what are we doing in that area?
I think I'm going to take that, and I have to say that your question needs a whole session. But I'm going to try and be very quick. Before even thinking of geriatric care, and for those of you who don't know, geriatric care is for older people, healthcare for older people. In some areas, many areas of the world, there is no access to care for even young population. So it's really a huge channel. But we, as a health organization at the International Diabetes Federation, we are working a lot on what I mentioned earlier, health literacy. And of course, on the early screening, as lately we are focusing very much, and I had a discussion earlier with somebody here, about pre-diabetes, which people tend to neglect. Okay, so I'm at the edge of the numbers, so what? No, it's actually critical. Pre-diabetes, we have millions and millions of people living with pre-diabetes. So again, what you're asking for is beautiful, but realistically kind of impossible. We are on the way, but yet a lot needs to be done. But early screening, we are doing massive campaigns at a global level as well as individual levels through our own organizations on the ground. We do, for instance, in Lebanon, my own organization does screening for displaced population, for refugees, because they don't have access to healthcare. So it's a whole new world, what we're talking about. We aim to, implement that, but there is a lot of challenges that we hope to overcome.
Can I just also respond to that? I think as Jackie is saying, not all older people have access to good care. So a lot of the work I do is actually with the community. The resource within the community, health literacy is very, very key. Screening, actually, except for diabetes, maybe the rest of it's like blood pressure and all that. It's not expensive to do. It's just about getting the community organized. And sometimes, a lot of times, older people organize themselves to help older people themselves. So it's basic good literacy, keeping health lifestyle, screening for blood pressure, that sort of thing. So I think that we do have to remember that other than the healthcare system, there's a lot of resources in the community as well.
Okay, we've run out of time, but no, here's the good news for people who are looking disappointed. We're going to continue talking after this.
We can go upstairs.
Upstairs, anyone who's got burning issues.
And we are going to have a workshop on longevity economy from 6 to 8 p.m. here, second floor. And the moderators are going to be myself and Cynthia Hanson of the Innovation Foundation. So if you want to elaborate more on those issues, please be welcome.
But I do welcome you to join us upstairs for any questions you've got. 3 panelists have been gracious enough to offer us more time.
Thank
so
you.
let's just follow us there, ask your questions, and please join me in thanking the panelists. Wonderful.
Thank you. Let's have a panel picture.